exciting news to tell you, so I can't wait to tell you, so please take your seats. Thank you very much, and welcome to Richmond Hill Council Chambers, the town of Richmond Hill. My name is Dave Barrow, and I will act as your MC for this great launch meeting this afternoon, and I bring you greetings from members of council. And actually, we have a quorum here, so work your magic. We have Regional Local Councilor Deputy Mayor Vito Spadafora. We have Regional Local Councilor Brenda Hogg. Ward 1 Councilor Greg Barros. Hello. Ward 3 Councilor Castro Liu. 4 Councilor Lynn Foster. Ward 5 Councilor Nick Papa. And Ward 6 Councilor Godwin Chan. Hello. Thank you for joining us. As I said, it's a very exciting day here in Richmond Hill and Southwest York Region. And certainly it's a culmination of a lot of effort that has gone in from a lot of people, including yourselves, and as part of community members and people that will be speaking to you later to explain what our announcement is. I just want to introduce a couple of people who will not be speaking. Unfortunately, resident Greg Sabera, you're in Richmond Hill, your hometown. MP from Vaughan, MPP, sorry. Yeah. And also past chair of our hospital board, Dave Weldon, is here. Nancy Cutler, volunteer with the president of the Volunteer Association, also a volunteer with the Volunteer Association. And certainly other board members and staff you'll be hearing from. So it gives me great pleasure to be here today as a proud member of York Central Hospital Board. It's been a pleasure working with such great people. Volunteers and the staff at the hospital have really are an engaged group of people looking forward to keeping the excellence in healthcare in this community and in Southwest York region. And really, community health care is the goal. Excellent community health care is the goal. And certainly with today's announcement, it's a new beginning that will enhance that care in all of our communities. So first to introduce you to is Dina Plaza. Dina is the chair of York Central Hospital Board of Directors, was elected in 2010, currently sits as chair of the executive committee, and has worked in a number of portfolios for the Government of Ontario, Deputy Minister of Revenue Finance Institution. I know, Dina, just a few more lines here. Deputy Minister of Emergency Services, Assistant Deputy Minister of Education, Chief Executive Officer of the Financial Services Commission of Ontario. A good person to have as chair. Dina.
Thank you very much, Mr. Mayor. It's a pleasure to be with you today, and on behalf of the York Central Board of Directors, to officially launch our new major regional healthcare mandate and unveil our new brand. Today's announcement is the culmination of over a year's worth of engagement of many people. Over 800 people in our community have participated. So in addition to the contributions of staff, of physicians and volunteers, we've also consulted with our elected officials, major donors, key opinion leaders, service groups, and members of the general public. And it was that rich and vibrant discussion that has brought us to this very exciting day. Organizations, as you may know, rebrand themselves for many different reasons. In our case, we have one of the very best reasons to rebrand. We have a change in our mandate. Our organization has been given the unique responsibility of becoming a major regional healthcare provider, which includes building a new hospital in Vaughan that will enhance healthcare services for all of Southwest York region. With the unveiling of the new brand, we are sending a clear signal of change and an evolution of our hospital into a regional healthcare system that delivers care through 2 hospitals as well as a network of community service locations. Over the past few years, our staff, physicians, and volunteers, along with the Board of Directors, have worked very hard to improve the quality and timeliness of care at our hospital. Working together, we've made some significant strides. 1, in reducing wait times. 2, improving patient satisfaction. And 3, achieving sound financial performance. As we launch our new organizational brand, we celebrate a new beginning that has built has been built on past successes. We have to remember that. Success that has been achieved through teamwork, accountability, and strong leadership. The recognition and celebration of our past success provides a strong foundation for the exciting challenges that the future holds in serving the needs of this community. So how will those needs be served? Our vision for the new major regional healthcare organization is, quote, to create a world-class health experience for all of the people of Southwest York Region. This vision expresses our commitment to creating high-quality care, outstanding customer service, and the shortest possible wait times for each and every patient. Our mission for the organization is to relentlessly improve care to create healthier communities. This elaborates on how we achieve our mission, our vision, and what we need to do every day to ensure that we reach that goal. It speaks to the benefit that we will achieve for the community, healthier communities, through our commitment to be absolutely relentless in finding ways to improve the quality of care as well as the care experience itself. So now, on behalf of the Board of Directors and its Brand Steering Committee, and on behalf of the hundreds of people who have participated in the development of this brand, it is my distinct pleasure to introduce our feature video, which introduces our new brand and explains the significance of that brand and the impact that we believe it will have on our community. When you see these results today, I know that you will be as excited as I am. Thank you.
exciting, a new beginning, historical tie. I would like to now introduce to you Altaf Station Wallo, President and CEO of York Central Hospital. He was appointed President and CEO of the former York Central Hospital in 2010. And prior to joining the former York Central, Altaf held the position of Senior Vice President and Chief Operations Officer at Mount Sinai Hospital. Please welcome Altaf Station Wallo.
I just thought of something, you know, I was hired as the CEO of York Central. Do I need a new contract now? So welcome everyone, and it's a pleasure to have all of you here today. It's been an amazing week of celebration for us. We started yesterday in the hospital where we revealed the brand and the name to the staff. We had about I think 600 staff, almost that number, in our Berwick auditorium, and they were so pumped by what they saw. They saw obviously the video and some of the messages that we're delivering today, and I think what we need to realize more than anything else is it's our staff that make the difference every day. To the residents of Richmond Hill who receive care in our hospital every day, it's those people that stand behind what we do, what we believe in, and what they saw with respect to Mackenzie Health is a very positive message. Certainty about the future, certainty about how services will be delivered in the Southwest York region, and a real ability to understand that growth will be supported as an institution. I know you can appreciate how challenged we are in terms of the volumes we receive every day at the Mackenzie Richmond Hill Hospital. And obviously even with our community-based sites, it's a challenge every day. So this added capacity in Southwest York region is most needed, and we will continue to obviously focus on the Mackenzie Richmond Hill site and continue to upgrade that as well. So it's a positive message all around, and I think we're obviously incredibly excited, and this video really does demonstrate sort of our history, but also our future. Very quickly, the extensive consultation that we went through, it was more than just coming up with a name and a logo. We have revisited our mission, vision, values, all of these key statements that represent what we are to a hospital. And we revisited because we've engaged the community. We've asked the community what they want, what they're missing, how they want to see things change, and the brand that you see today really does reflect that. Healthcare is about hospitals, but healthcare is about many more things than that. So you see that this new system, this new structure is founded with 2 core full-service hospitals and a bunch of community-based services. And at Mackenzie Health, we see that as the future, evolving more and more care in community-based settings, in environments, in people's homes. To give you an example, we have evolved our chronic kidney disease program. We're the regional provider for all of York region. We do almost 100 clients through home dialysis now. They can actually receive care in their homes. And now we've evolved it to nocturnal dialysis where they can actually sleep in their own beds and be dialyzed at home. So Mackenzie Health stands for more than just 2 hospitals. It stands for a whole delivery model of care. And I think our engagement with the community really did demonstrate that. They want care, they want it in different ways, and they want it to be the best. And I think that's what you're going to see as we evolve. Obviously, we can't forget the past. York Central has a proud history. Its roots are strong. We actually just celebrated the Volunteer Association's 50th anniversary. And it was remarkable to see that group celebrate the past, yet be very much engaged about this future. They were very supportive of this brand and obviously aligned themselves to this. So I think the future is very bright for Mackenzie Health. Mackenzie Health is built on a solid foundation, the history of York Central, and it will continue to evolve in 5, 10, and 20 years out. This is a model of care that will continue to change as healthcare changes in Ontario. As the regional healthcare provider, our biggest challenge is population growth. We are at a regional level the fastest growing community in all of Canada, and you compound that with an aging population and chronic disease, it really starts to challenge us in terms of our service delivery model. So you will see this institution innovating care and trying to deliver care in different ways. Along with those 2 hospitals, the community locations that you saw on the map, that was something that we never really promoted, I think, to the extent that we could. So for example, I don't know how many people in this room knew that we actually provided services out in Barrie. We are the Acquired Brain Injury Program, Behavioral Management Services up in Barrie. So the distributed model has been a legacy, a foundation of York Central, and obviously that will continue. Now, the other part of the name, as you can appreciate, is the history that it connotes. So it leverages history with respect to Southwest York Region and our nation as a whole. Addison Alexander Mackenzie was a member of the Ontario Legislature, respected veteran of Vimy Ridge, for whom Major Mackenzie Drive is named, and 3 Canadian Prime Ministers, not 2, but 3 we've discovered, more than in Mackenzie: Alexander Mackenzie, Mackenzie Vaughan, and William Lyon Mackenzie King. And more importantly, the location of the 2 hospitals, both situated on Major Mackenzie Drive, fundamentally bridging our 2 communities of Richmond Hill and Vaughan. Now, obviously, Dina spoke to our mandate to continue to improve quality and to drive care closer to home, and I've talked about some of those models. One of the things that we will be exploring as we move forward is to ensure that both hospitals have core services and that we're able to build more specialized programs at both hospitals with a larger critical mass of service. So I think as residents of Richmond Hill, as residents of Southwest York Region, you're going to see more care closer to home because we're going to provide more specialized care because of this larger critical mass of service delivery. Now, in closing, the other key piece and the confusion that used to exist, I think, around the different models and different brands, I think we are finally at a place where our clients, our patients, our families can actually navigate the healthcare system and our offerings much more effectively by having this united brand of Mackenzie Health. So I thank everyone for being here today. I'd like to thank the town of Richmond Hill, Mayor Barrow, for hosting us. It's been an amazing day for us. We started the day in Vaughan, coming here to Richmond Hill. I thank you for all your support, for all the presenters today. And the future for Mackenzie Health is incredibly bright. We're pretty excited about what we're going to create in the next few years. So thank you for your support.
Thank you, Altaf. And next to speak, as we spoke of the staff announcement, we have Dr. Eric Fomberg, who was appointed the Chief of Staff in June 2011 and as an emergency physician with a track record of leadership excellence in both public and private healthcare sector. Please welcome Dr. Fomberg.
Well, thank you very much for the opportunity. I must say, when I was in Vaughan this morning, I was amazed at the ability of the politicians to deliver an address without using any speaking notes, and for such long periods of time. That's right. Me, I need speaking notes. So it is indeed a banner day, and not only because I shattered my own personal record for eating the 9 bars before 2 o'clock, but you know, it is an exciting time for the organization, no question about it, with the broader mandate, the new brand. This is a once-in-a-lifetime experience, I think, for most of us in healthcare to be involved in such a huge growth opportunity. This is not about taking 3 disparate hospitals and putting them into a larger building, but rather really, for all intents and purposes, doubling the size of what we do as an organization and starting fresh in many respects. So it really is very exciting. I would like to suggest that having been here for a year or so, I've had an opportunity to work with marvelous frontline providers, professional staff, not only physicians, but the full range of allied health, and it's been an absolutely wonderful experience. I think we all need to remind ourselves that while managers and chiefs of staff come and go, our frontline providers, physicians, nursing staff, etc., will be here for the long term, and it's really important to make sure that we can get them to buy into this vision and to our new brand. The incredible excitement that I saw yesterday needs to be sustained. Not perhaps at that same fever pitch, but we must continue to move forward. I think that as well, we are currently functioning, as far as physicians are concerned, in a buyer's market, not a seller's market anymore. So it's up to us to leverage that brand to make sure that we can continue to attract the brightest and the best, and to articulate a model of care that Althoff alluded to that will meet the needs of our patients, families, and communities, and provide all of those services with great care, respect, and dignity. Thank you very much.
Thank you, Dr. Von Berg. And next we will hear from Fraser Nelson, that's appointed to the former stage board. Remembering that. Mackenzie Health, Richmond Hill, following his appointment as chair of the York Central Hospital Foundation, now known as Mackenzie Health Foundation, and he was reappointed this very morning as at their AGM. Fraser Nelson to speak to you from the foundation.
So my task today is to, in very short order, try and give you a bit of the past, the present, and the future. So it's a pleasure to be here. So past is York Central Hospital Foundation was officially created in April of 1977. So we have a long legacy of looking after the Southwest York region needs of hospital care. And of course our goal remains to raise funds for medical equipment, staff education, and capital improvements not otherwise funded by provincial government. All of this in the past to support York Central Hospital. So since inception, thanks to the generous people in Richmond Hill, Vaughan, and beyond, and I will stop and say, and the town of Richmond Hill specifically, we have funded over $65 million towards this goal, providing such things as CT scanners, our first MRI, 2 minimally invasive surgical suites, and much of the construction to build the town of Richmond Hill wing at the renamed Mackenzie Richmond Hill Hospital. So the present means that on May 15th, at the request of the York Central Hospital Board, the Foundation did take on the mandate to accept the challenge for an expanded mandate to raise funds for both the former York Central Hospital and to help build a new hospital in Vaughan. And I am proud to announce that we have now officially become the Mackenzie Health Foundation, as shown on the board that you have in front of you. So where does that leave us? So under the Mackenzie Health Foundation banner, we intend to unite our community in the common goal of providing the best of healthcare close to home for Southwest York region. The future is going to be over the next 10 to 20 years. We will see a hospital built in Vaughan starting in 2015, opening in 2018, with a requirement to fund the local share of over $150 million. Your foundation is not losing sight that we will continue to fund the needs of Mackenzie Richmond Hill Hospital during that time as well. I know we're up to it. We absolutely are. And while the task is large, the foundation, with your help, is up to the challenge. Now, I paraphrased the joke in Vaughan because I was looking at people saying it, whether it's the minister, the rabbi, or the priest who says we have a problem, we need money, but I have the answer. I'm looking at the answer. And they all got it. And I know you get it as well. I'm looking at the answer to those funding needs. So we look forward to the funding challenge, and we embrace it and welcome it, and we'll get there with your support. Thank you.
Thank you, Fraser, and as always, we can count on the generosity of the communities in Richmond Hill and Southwest York region, certainly to help fund this new exciting venture into a major health provider. So I now have for you Mr. John Lang, currently serves as chair of the board of directors of the Central Local Integrated Health Network, known as the LIN. He retired in 2010 from the law firm of Fraser Miller, and where the position since 1976. He's also the former governor of the North York General Hospital Foundation. Please welcome John Lang.
Thank you very much. I also require a few notes. But appreciate the opportunity to be with you today, and at the launch of the Mackenzie Health, which is a major new healthcare provider into Central Lynn. Earlier this year, the Ontario government released the Action Plan for Healthcare, which establishes a roadmap for transformation to a smarter and more efficient healthcare system. At the heart of the plan is a commitment to provide people with the right care, the right place, at the right time. This approach is essential to achieving what we all want, a high-quality, person-centered local health system. Having timely access to care is critical. It's a system we need to continue to improve how we deliver it and strive to make it easier for people to get to the right services where and when they need them. Mackenzie Health is a great example of how we're moving in that direction. Through the newly renamed Mackenzie Vaughan Hospital and Mackenzie Richmond Hill Hospital, together with a number of community-based services, Mackenzie Health will offer quality care closer to home under one umbrella. It'll be easier for people to navigate the system with a single point of entry. Decisions will be made based on needs of the people and the system rather than individual organizations. Central Lynn is committed to working together with all our health and community service providers to build a more integrated and patient-centered local health system. The needs will need to be addressed in the context of three major population trends, and Al alluded to them. Currently, there are 1.8 million residents in the Central Lynn. It is the most populous and fastest growing Lynn in Ontario. Over the next 10 years, we will experience an increase of population of 20%, and that is much higher than the growth rate in the rest of the province. Our population is aging. In 10 years, people in the Central Lynn communities over the age of 65 will be increased by about 57%. This means an additional 136,000 seniors by 2022. 49% of the Lynn's population is comprised of immigrants. This is the highest proportion among the Lynns, and over the next 10 years, an additional 200,000 newcomers will be expected to enrich our communities. As our population ages, more people will be living longer with more complex health problems. We will need to collaborate even more, to share more information electronically and develop new approaches to serve this ever-growing population of seniors and diverse newcomers. Central Lynn looks forward to working with Mackenzie Health to build the capacity in our community to support the provisions of the appropriate services for people that are closer to home and achieve a better standard of care. Thank you very much.
Thank you, John. Our next speaker needs a little introduction here in the town of Richmond Hill. Very good friend of the town of Richmond Hill, and certainly a great friend of the former York Central Hospital. My notes are dated by about 20 minutes. So, I would like to introduce to you Mr. Reza Meridi, MPP for Richmond Hill. As we know, Reza was first elected in 2007 and re-elected in 2011. He has lived in Richmond Hill since 1991 and has served as parliamentary assistant to many ministers at the Queen's Park. I'd like you to welcome MPP Reza Meridi.
Thank you very much, Your Worship. Good afternoon, ladies and gentlemen. I'm so pleased to be here today to mark this momentous occasion with all of you. I bring greetings on behalf of the Honourable Dalton McGuinty, Premier of Ontario, and the Honourable Deb Matthews, the Minister of Health and Long-Term Care, as we mark this incredible achievement for Southwest York region, and indeed for the residents of Richmond Hill. We have come a long way to making this day a reality. Our main goal as a government when it comes to healthcare is to keep people healthy, to deliver good care when people need it, and to protect the health system for future generations. Up until now, the hospital formerly known as York Central Hospital, now Mackenzie Richmond Hill Hospital, has provided outstanding care for us and in the future, we will be able to leverage on the capabilities of Mackenzie Health to enhance the quality of life for the residents of Southwest York region. Richmond Hill residents will soon be able to draw on a formidable mix of two full-service hospitals of the Mackenzie Health system, along with a network of community-based services to achieve this goal. I look forward to 2018-2019 opening of the Mackenzie Vaughan Hospital, as well as the continued expansion of the Mackenzie Richmond Hill Hospital. Mackenzie Health will be a legacy for all of us. As my wife, children, and I have been depending on the services of York Central Hospital since coming to Richmond Hill over 20 years ago, from a country where they have no such luck. Now so do my two granddaughters. Ladies and gentlemen, it is our collective responsibility as a community to ensure that our youngest generations have services they can count on for their future. Much has been said today about the rapid expansion of York region, and nowhere is that seen more than Richmond Hill. We have the world that has come to our doorstep, seen through the ethnic and cultural diversity of our constituents. Through my community office, which is right around the corner from the hospital, I see firsthand myself how intrinsic the sustainable and quality health care is for our families. We have an incredible public health system in this country, and our dependence on good care is what should drive us to deliver the best possible service. In closing, I want to thank Dina Plozzi, Chair of Mackenzie Health. It will be Health Sciences in the future. When we bring medical school here, I'm sure Greg would agree with me. Mackenzie Health Board of Directors, Altaf Stationwala, the President and CEO of Mackenzie Richmond Hill Hospital, physicians, nurses, professional and support staff of the hospital, President Nelson, President and Chair of Mackenzie Health Foundation, and Bill Lacey, Executive Director of Mackenzie Health Foundation, Board of Directors of the Vaughan Campus of Care, Mayor Barrow, members of the Council of Town of Richmond Hill, Mayor Mauricio Verolacqua and his members of Council, Chair Bill Fish, and of course my good friend Greg Sorbara, who has actually implemented the seed of this Vaughan Hospital 10 years ago, and all volunteers and donors of Mackenzie Health for working very tirelessly over the past many years to bring us today to this place. Thank you very much.
Thank you, Reza. Well, it's been an exciting afternoon. Before we wrap up, I just want to say myself that Mackenzie Health, I'm trying to get it to roll off my tongue, will build on almost 50 years of delivering excellent health care at the Mackenzie Richmond Hill Hospital, formerly known as York Central Hospital. We'll say that for the last time, I guess. And I think through this new major regional health provider, we can assure Southwest York region has access to the very best health care on a daily basis. Thank you for coming. The town of Richmond Hill has been very proud to be a part of this exciting announcement, and we thank you for supporting your hospital and your community. Thank you very much.